Sisters of Charity Hospital is gearing up for their vascular health screening. And today we're here with Dr. Paul and I. Dr. Paul, it is good to be back.
Nice, thanks for coming out and to see us today.
Yeah, it is good to be here. Talk to us about the screening.
It's free to the public. We just ask you to call and register. And we do screenings pretty much for the whole vascular system, looking at their carotid arteries in their neck to make sure they're not at risk of a stroke. We look at their abdominal aorta to make sure they don't have an aneurysm. And we check their lower legs to make sure they have good blood flow to their lower legs to make sure they're not at risk of losing their leg or having any complications from that.
How long will the screenings be?
The screening's usually from 8 to 3, but each patient will probably take a half hour to go through the process. It'll also include blood sugar testing and blood pressure testing.
And who are the screenings open to?
The screening is open to the whole public, but we do look for patients over 55 years old that may have a risk factor of blood pressure issues, hypertension, or previous diagnosis of peripheral vascular disease.
And why is it important for Western New Yorkers to come to a screening like this?
Well, I think it's important, especially in our area where there is a high incidence of peripheral vascular disease. Most of the symptoms aren't there at first until there's a complication of a stroke or a ruptured aneurysm or a problem with your leg. So if we can identify the patients early, we can treat them usually in and out surgery without causing any problems, and they usually have no deficit afterwards.
The screenings are going to be free, but should you register ahead of time?
Yes, you do need to register to secure a time. The number is 447-6205 to register.
Dr. Nine, talk to us about where we are located today. I understand this is a new addition to Sisters.
Yes, this is one of our twin hybrid rooms, and it's a very advantage to the surgeons here because we can both do our vascular interventional procedures where we treat the patients just through a needle stick, but if need be, we could also have them asleep and doing our open surgery. So we consider it a hybrid room where we can do everything in this one room and treat the patient in total that day.
Are you focusing on any new procedures in this room?
We are. We have 2 new procedures we're doing, but the one we're doing the most of is a new way to treat carotid artery disease with a stent, but we don't have to go through the groin. We do through a small incision in the neck, and it's really been shown to decrease the risk of stroke.
Overall, what can we do to maintain our vascular health from day to day?
Well, the main thing is really trying to have a healthy lifestyle. If you smoke, please quit smoking. That's the #1 risk factor. Exercise, work on your weight, work on your blood pressure, try to lower your blood sugar, and exercising 25 minutes a day has been shown to increase your overall vascular health.
So live a happier, healthier life.
Happier, healthy life, absolutely.
For the screening, should we bring anything?
Nope, you don't need anything to bring. We'll make sure you get a copy of all your reports, and a copy of your reports will also be sent to your primary medical doctor. You just got to bring yourself in a good attitude.
All right, hey, that sounds pretty simple, Dr. Nine. Thank you so much. All right, so you don't want to miss Catholic Health's vascular health screening. That's Saturday, April 21st from 8 to 2 p.m. at Sisters of Charity Hospital. If you are interested in attending the screenings, please, by all means, give them a call, 447-6205. Again, it is 447-6205 for vascular health screenings at Sisters of Charity Hospital. And we'll be back right after the break.